You were listening to your host, Cade Archibald. I'm the coaching director at Go Wellness and also the clinic director at East West Health. And so I am here to take you on an amazing journey today. Hope you guys are fired up and ready to go over some cool stuff. So today, what we're going to be talking about is a little bit unique. Reagan is actually at a his 10x coaching conference, so you guys get to listen to me the full time. So hopefully no one's offended, and hopefully I can be entertaining enough for you. So we're gonna go over a lot of cool stuff. And it's going to be primarily what I'm going to be talking about. We're going to go over natural weight loss solutions with reversing brain fog, leaky gut, and thyroid problems. We're going to do kind of a patient seminar that we do, that I do on a weekly or bi-weekly basis. So this should give you guys some great insight on how to do that. And so this is going to be more for a promotional webinar rather than protocol based. So, but you'll also I'll go through a few kind of high level things throughout. But this is a presentation we typically give to patients. So this will give you a good idea of how you can present better to patients, potentially have better results on patients wanting to come to you for care. So before I jump into the presentation, I want to make sure I cover some of the housekeeping items. So just so you guys know, Reagan has been putting together an amazing program with the Stem Cell Therapy Revolution program. It's a very minimal monthly fee to get involved with that program. And then we also have our live event coming up June 23rd and 24th. It's in Salt Lake City. If you haven't had a chance to get registered for that yet and you're looking at getting stem cells implemented into your clinic, I would not miss this event. It's going to be awesome. There's going to be injections training for practitioners. There's going to be admin training for your staff, for case managers, and really help explain how to communicate everything from A to Z. And so that program is going to be huge for realistically, anyone that's looking to get stem cells set up in their clinic. So so just give us an email, info@gowellness.com, if you're interested in attending that, or watch our emails. You'll probably see some of the promotions on that. Second thing I wanted to cover is for all you healthcare entrepreneur functional medicine clients out there. Our next event's July 15th and 16th in the LA area. We had to change the hotel venue last minute, so I want to make sure the word is out. That will be at the Renaissance Hotel in LAX. So it's just right off the strip by the airport there. The Renaissance Hotel. We do have block pricing. If you need any details on that, we have a link. I can email that to you. I'll email it out to all the clients. And any guests that are on this webinar and interested in attending one of our upcoming events, we do have initial discounts for first-timer guests. So give me a call. I'll go or shoot me an email, and we'll schedule something so we can go over and see if it'd be a good fit for you. So info@gowellness.com. And then we do have just listed dates upcoming. So after July 15th, 16th in LA, we got October 14th and 15th in Salt Lake City, and then December 9th and 10th in LA. And those are for the Healthcare Entrepreneur Functional Medicine Training Program. So make sure you got your calendar set, ready to rock on those. And let's get started. So today, and seeing quite a few more people have joined. So if you're waiting for Reagan to start talking, I'm sorry. He's doing some training today with actually his coach Dan Sullivan. So he's getting some awesome information and content to help train you guys better. So today I'm going to be going through our patient program. So this is our patient presentation for natural weight loss solutions with reversing brain and fog, leaky gut, and thyroid problems. So I've kind of tweaked this over time. You've probably seen a rendition of it before from Regan. I'm going to do my edition of how I present this to patients and everything. I've tweaked it to include natural weight loss solutions. The biggest reason is that's a huge driver, especially in the springtime, summertime, when people are getting outdoors more. They're a lot more keen to respond to marketing on weight loss solutions. With functional medicine, the beauty of it is as long as you get the body functioning properly, it's going to maintain a healthy weight. And so if someone's overweight, they got weight to lose, they're going to start losing weight if they follow through with your recommendations. So it really doesn't focus on weight loss, but it is that's the whole point. And you'll hear me kind of feed some things throughout with belly fat and different things. So let's get started. If you guys have questions, you can either raise your hand and I'll unmute you, or just type a question in the chat box, and I'm more than happy to answer any questions. So to give you guys some ideas on how we're marketing to get people to this event, you can do newspapers. So you can put a cool ad, and for clients we have a lot of different ad examples. I'll still get at least 3 to 5 leads each week if I do it. If I advertise in the newspaper, you can do Facebook ad campaigns and have them go to a landing page and have them opt in. The biggest thing there is you got to follow up with them within about a couple hours to confirm them, because it's too easy online to just click yes, I'll be there, and actually not show up. That should get, also postcards can be really effective as well, but that should give you some ideas on how to get people there. Also, just even going and into your community, doing something like this at a Whole Foods or a kind of a natural grocers type facility, anywhere. And this is great to just get your message out, get some good promotion for people. All right, so let's get started. So this is actually a really long testimonial reel. We'll typically have this going kind of when they come in. After a few people start showing up, we'll have that play, and it may play once or twice just on a reel, but that's a testimonial reel. I'm not going to put you guys through that. So I always like to start it off with asking a few questions. So and this topic's I always like to ask, all right, well, who in the crowd here, which one of you thinks you might have brain fog? And you'll have, like, some people half raise their hand, some people just shoot it right up, and then some people might not move their hand at all. I always like to ask, well, all right, so who forgot? Because that's usually what happens with brain fog is you may not remember everything. And a lot of people in the crowd will also ask, like, what is brain fog? I don't really know what it means, but it sounds like what I have. And so that's perfect. Well, yeah, a lot of people don't understand what brain fog is. It's actually the inability to focus, poor memory functioning, and difficulty learning new things. And really what I want to jump into today, once we kind of have a good idea of what our goals are and everything, is I want you guys to understand what's that root cause and everything. And so before we jump too far in, I want to go through a couple different promises of what our goal is tonight. And so at East West Health, we are huge on education, and so we believe that in our health system today, would you guys agree with me, we're probably not doing as an effective job at educating our patients as we could. Everyone agrees. And so my promise to you tonight is before you walk out that door, you're going to learn something new, something that you wish you would have heard a long time ago. Maybe you wish your doctor would have told you about these things. That's almost everybody that comes to these events, they'll walk out saying, man, I wish my doctor would have told me about this, that there's another solution. Is that fair with everyone? Is that, hopefully that's why everyone's here. And you really want to get some crowd interaction there. And then the second promise I want to make to you is I'm going to give you an opportunity to do something about it, to have a potential plan of action to really come up with a solution to change your health. And so what we've done at the end of this presentation, if you feel like, yeah, I want to work with these guys, if you feel like we're sincere and we can get to the root cause of what your health problems are, then I challenge you to take advantage of it. We have a discounted consultation for you. Is that fair to everyone? So you want to make sure, just ask. Everyone say, yeah, that's yeah, we'd like that. All right, well, let's jump in. And so we're talking about brain fog. Anyone wonder what happened to your brain? If you have a tough time remembering things or recalling things, or you're in the middle of a conversation and you just kind of stop, that's not normal. We want to figure out what's causing that. What we found in all the research that's out there on the brain and all these different things, that really ultimately the root cause of this is inflammation. That can cause digestive issues, thyroid problems. It eliminates that spark. The other thing that inflammation can do is it can actually cause you to gain weight. And so I know a lot of you are here tonight to learn natural solutions for weight loss. And so I want to make sure you understand what we view as weight loss and gains. Is weight loss is not the problem, or too much weight or being overweight is not the problem. That's a symptom of an underlying problem. And so what I want to go through is what are some of those underlying problems potentially, and once you reverse those, that weight falls off. Because how many out there have been counting calories? You have maybe half the room. Anyone ever counted calories before? How sustainable was that? Did you lose weight? Yeah, most of us, when we cut calories significantly, will lose weight. But the real question is how long can you sustain that, and how good do you feel? You probably have more brain fog. You probably feel worse in your skin. You probably feel very irritable. And so there's better ways of losing weight than just trying to focus on counting calories and exercising more. So let's so before I jump into the presentation, I want to share a little bit about my story. And just to pause on the patient perspective, I always recommend to everyone, if you're presenting to the patient, share your story of how you got into this medicine, or what you like, what drove you, how you're passionate about this, because that helps generate a connection. So back to my story. So the whole way I got into East West Health, you notice my name. I'm not necessarily a doctor, a chiropractor, or a practitioner. I'm a health coach. But how I got involved here is about 6 years ago. I was suffering from kind of my own health problems. I was quite a bit overweight. I just didn't feel right. I didn't have the energy and the spark that I wanted to. And I was trying everything. I was doing CrossFit about 5 days a week, just trying to exercise it all out. I was counting a lot of calories and figuring out, what ideally, how much food should I eat. And I was doing this and just trying as hard as I could to lose weight, and I actually was getting more and more inflamed. Yeah, I was putting on muscle, but at the same time, I just, like, my brain was shutting off. I did not feel right. I was tired all the time. Couldn't even spend time with my kids when I got home because I was so exhausted. And so when I looked at what I was doing, finally, after a few months, I reached out to my brother, who happens to be the founder of East West Health Reagan. And I was so glad that I did, because what we did is he ran a few different tests. We looked at some food sensitivities. We looked at what was happening in my digestive tract. So we did some stool testing. Yes, that was very pleasant to do, and and so and we also looked at some hormones. And so what we discovered is I had some autoimmune responses starting to happen. I had psoriasis on my hands quite significantly. My digestive system was really out of balance. I had some yeast overgrowth, and just not in good shape. And so over the course of 3 months, after following some of his guidelines, following through with some foods and eliminating the foods that were causing more and more inflammation, I lost about 30 pounds over the course of 3 months. And then from there, I lost an additional 20 over the course of another 6 months. So 9 months total, I've lost about 50 pounds. And my spark is back, my energy's back, my brain's back online, and I feel so much better. And so that really started my transition into more functional medicine. I started researching lifestyle adjustments with labs and really how to integrate that, because that was fascinating to me. Is instead of looking at lab values to prescribe medicine, which you guys would probably say that's primarily what Western medicine is all about, right? We actually look at, okay, well, what foods can you eat to improve these lab values? What lifestyle adjustments can you make? When can you exercise in the day to help balance your hormone or your cortisol levels better? That's really what we looked at. And so that was a really exciting journey for me. And so I love sharing my story, and that's really why I'm up here talking to you guys tonight. Is so that you have an understanding of where I come from, because I've gone through this. I love what we do, and I'm very passionate about it. And so my goal is, hopefully we can help each and every one of you in here to improve your health and to improve your life. And so would you guys agree with me, when you look at today's healthcare system, do you agree we're in some sort of health crisis? Or is it a healthcare crisis or a health crisis? Yeah, both. I would agree. That's why the British Medical Journal actually says 85% of all medical procedures and surgeries are scientifically unproven. And to top that off, 90% of diseases prevalent today are not treatable with orthodox medical procedures. So now I want to be clear here. If you're like bleeding out of your arm, or you've broken a limb, or maybe you're having a heart attack, please do not come to our office. That's not our expertise. That's where you go to the hospital, and they're amazing. Western medicine is phenomenal when it comes to emergency care and that catastrophic care. Technologies are advancing every day to help save lives, but when it comes to some of the more chronic conditions, some of the metabolic syndromes, some of the thyroid problems out there, and the autoimmune issues, what's the typical treatment? And so most people say medications. So there's a pill for that and there's a pill for this. Does that fix the problem, though? No, it doesn't fix the problem. It actually causes a bigger problem. And then when you look at how our healthcare system's being addressed, or how it's addressing it, the healthcare system, it's very fragmented. And so if I have brain problems, has anyone heard of the fact that your gut health has a lot to do with your brain health? Some will say yes, some will kind of look at you like, oh wow, that's cool. Yeah, well, recent research has shown that your microbiome is extremely critical to produce neurotransmitter signals and to help your brain function properly. And so, do you think your GI doctor is talking to your neurologist if you have brain problems? Typically, no. It's very fragmented. And then we'll talk a little bit about insurance and how those things. I love this slide, not because it's right, or it is right, but it shouldn't be the case. But it really this can help you help people understand that your insurance isn't there to improve health. It's there realistically. Insurance is for catastrophic events. If you have a heart attack, if you cut off a limb, if like some catastrophic thing happens, it's there to protect it. It's there for insurance. It's more of a protection from loss rather than improvements. So make sure people understand that. That way, at the end, they're not asking you, well, does insurance cover this? Did the food pyramid help? No. If you're taking 6 to 11 servings of grains a day, especially how commonly they're processed in today's world, you will probably promote more and more autoimmunity systemically throughout your body, and that was one of the big things that I was able to find with my testing. What we're up against, you guys are all aware of what's going on with Bayer and Monsanto's, a huge chemical company teaming up with a pharmaceutical company. All right, so what about our health habits? Do you think as Americans we are extremely proactive when it comes to our health? Now, you guys that I'm talking to on the webinar, you're probably saying, yes, I'm extremely proactive with my health, but as the average American, no. We're not being proactive. We catch ourselves, walking our dog in the, we're in sunny St. George, so I always say it's probably a golf cart is where you see this, but yeah, get out there. We actually have a class. It's called We Can't Exercise For You. And why do you think it's called that? Because we can't exercise for you. Your bodies are made to move and to function, and so you got to get out there and move. All right, so let's get into more of at the clinical setting. So if you look at different causes of inflammation, you have physical traumas that can be sports injury, car accidents. You have chemical traumas or stressors. That can be from the air we breathe, the water we drink. In our wellness programs, we say you can only have 12 beers a night. That we kind of cap it off at that. No, so yeah, alcohol can be a toxic as well. Emotional stressors can be an issue. That can cause a lot of inflammation if you are holding in a lot of stress. So this is where I like to give you a tip. So tip number one is you got to learn to breathe. So we have a Japanese mentor. You probably heard Regan talk about her, Sheiko Maekawa. She says the fastest way to die is to stop breathing. And if you look at studies, there's multiple studies showing deep belly breathers compared to shallow breathers have a much longer life expectancy. And so every time you get stressed and you're holding your breath and you're frustrated and you get all this tension in your shoulders and your neck, you're cutting years off your life. And so instead, when you feel that stress, you got to do some deep breathing. So you do 5 seconds in through the nose, take a pause, and then 5 seconds out through the mouth. And make sure you expand your belly. And I'll typically do that once with the crowd. And then the last thing that you want to look at for causes of inflammation is infection. So that could be in your GI tract. Typically, there's a lot of things that can go unnoticed, even though your labs say, oh, everything looks fairly normal, but that can be a huge thing. Um, Also, some other factors with inflammation can be your genetics. Your MTHFR gene, there's a protein that actually helps you synthesize your vitamins, your B vitamins specifically, and so you can be predisposed to high homocysteine if you have that MTHFR mutation, and so getting the right foods and also the right form of B vitamins, because you're not going to be as effective at breaking folic acid into a usable form. And so you want to make sure that you're getting good foods, but then also you probably need some supplementation. If you have some of these genetic or methylation issues, you'll probably suffer from a lot of these different side effects. Insomnia, might have muscle joint and pain, might get rashes easily, heart palpitations, anxiety, headaches, a lot of those things. And so that can be from either over or under methylating. And so it's really good to understand your genetics and figure out a good solution on how to address them. And when you're looking at treatments for MTHFR, you want to look at their COMT mutation as well, and this is going a little bit deeper. So if someone just has the MTHFR gene mutation, but they're normal on their COMT, just some typical methylcobalamin B12 injections. We'll typically do 1 milligram per day or per week, intramuscular injection. You can also use, there's a lot of other options for some methylfolate. And then you'll want to look at their COMT, because if they have a COMT mutation, you'll probably want to use hydroxycobalamin rather than methylcobalamin. That'll be an easier form for the body to convert. Let's talk a little bit about leaky gut. So you guys all understand what leaky gut is. I always like to explain it very simplistically, or as simple as possible, but leaky gut affects the whole body. And so if you're looking at your digestive tract, you have these little single cell walls that make up your intestinal wall. And when there is inflammation or anything, they have these joint gap junctures. I'll put my knuckles together and help kind of explain how they look. And when inflammation happens, they can break apart. And so then proteins can get into your external body cavity where they're not supposed to be. And what do you think that does to someone's immune system? Think the immune system just thinks it's all cool, or do they get pretty activated? Yeah, your immune system starts going pretty crazy. It can affect your sinus in your mouth. When I was going through my issues, I always had sinus infections. I was constantly blowing my nose. You'll notice skin issues, thyroid problems. It'll end up in a lot of different areas. All right, so let's talk about, so if you're looking at losing weight and some of those things, what about lowering cholesterol? Or even looking at it from a brain fog perspective, does that help? No, that'll rob your brain. Yeah, but if you look at the #1 kill in our country's heart disease, and this is a pretty phenomenal statistic, Lipitor will actually reduce your risk of heart attack by 36%. Wow, that sounds amazing, right? But if you look at the fine print, that actually means in a large clinical study, 3% of patients taking the sugar pill or placebo had a heart attack compared to 2% of patients taking Lipitor. So is it really that significant? That's a more dated journal reports no evidence linking high cholesterol with women and heart disease. This study is this was a huge study done by the New England Journal of Medicine, published there. They found that medications did not reduce heart disease despite lowering blood pressure, lowering blood sugar, and lowering cholesterol. They actually found a lot of devastating side effects. So some things I like to ask are, did the drugs do what they were, the drugs did what they were designed to do, didn't they? Because you have a medication that's designed to lower blood pressure, you have a medication that's designed to lower blood sugar, and you have a medication that's designed to lower your cholesterol. But just by doing those things and looking at your labs and saying, oh, everything looks great, is that actually fixing the underlying problem? No, it's not fixing anything. It's just masking a symptom. It's just putting a Band-Aid over it. And so when you're looking at your health, you want to actually figure out what the underlying problem is. If you have heightened levels of cholesterol, what potentially could that mean? Cholesterol is a natural anti-inflammatory. It helps heal up vessel issues, vessel inflammation and damage. So do you think if your cholesterol is high, what could be the culprit? Yeah, it could, and also it could be your liver as well. Your liver is that's the organ that helps produce your cholesterol, as well as your thyroid. It could have a lot to do with those things. So don't just settle for a medication to fix your problem. Settle for figuring out what the problem is. Because cholesterol, your body can't function without it. It'll actually cause, it's huge for your neurotransmitters. Cholesterol is needed to produce your neurotransmitters and to communicate with each other in your brain. And so if you're on cholesterol lowering medication and your cholesterol's within normal ranges perceived, but you still have a lot of brain fog, you feel sluggish, you just don't feel right, that possibly just could be a side effect from your cholesterol medication. These are some of the factors that cholesterol lowering drugs do. So not ideal. From Dr. Sinatra, he's a very infamous cardiologist. Cholesterol level of less than 160 can be linked to depression, aggression, cerebral hemorrhage, loss of sex drive. That is not a good thing. So just to lower your cholesterol just because it's a little bit heightened, I would avoid that. All right, so let's talk about your thyroid. So everybody point to your thyroid. So it's this awesome gland right on your throat, and this your thyroid can do a lot of things. So for all of those of you that are here to learn about weight loss, if your thyroid is not functioning properly, you are going to have a very difficult time losing weight. It's huge for your fat burning hormones. It helps with bone metabolism, helps with motility signaling to your digestive tract. So if you have constipation problems or different digestive issues, that very well could be your thyroid is causing a lot of those issues. If you have, if you're on like say omeprazole or acid reflux, that could be linked to your thyroid as well. If your cholesterol levels are extremely high, what happens is your thyroid hormone creates a receptor site on the cell for your LDL or your low density lipoprotein to attach to the cell and be used. And so if your thyroid hormones aren't functioning properly, your cholesterol may not get absorbed into cells, and then it's going to accumulate in your bloodstream. So thus having high LDL or the perceived bad cholesterol. So let's talk about how your thyroid functions and how it metabolizes. So I always like to use the analogy of your thyroid is like an idling engine. If your idle's set too high and you stop at a stop sign, what's going to happen? It's going to rev up. You're going to burn a lot of fuel. Eventually, it could blow a gasket, right? If it's set too low, you go to a stop sign and your idle's too low, it's going to be really sluggish. It's going to be tough to get going. The same goes for how your thyroid functions. You're just going to be sluggish if your thyroid's not producing enough hormones. So most of what your thyroid produces is what we call T4, and then a small portion is T3. So with T4, we like to look at that as if it's like crude oil. So has anyone tried putting crude oil in their car before? You probably didn't get too far. It's got to go through a conversion process, right? Get converted into gasoline. And so with your thyroid, if you a huge part of your thyroid is producing T4, and so for those of you that maybe your doctor's checked your thyroid and he's looked at your free T4 levels, your TSH, some of those things, and it looks like, hey, your thyroid looks completely normal. You're totally fine. You're probably not digging enough and looking at really what's potentially the problem, because your thyroid will produce T4. It's then synthesized in your liver, and a huge portion of that is converted into T3 right there from your liver. T3 is like the bioactive form of your thyroid. It's a lot easier for the cells to use, and if you're low in T3, typically what the symptoms will be is you'll have a tough time losing weight, your energies will be lower, a lot of things there. And so if you're not looking at your T3 numbers, you're really cutting yourself short. It's really important to have your T3 levels at a reasonable piece, because if your liver is stagnant and it's not functioning properly and converting that T4 into T3, then it's going to look like you got a thyroid problem, but realistically you got a liver problem. And so you really want to look at all the different aspects of your thyroid before you just start taking a thyroid medication, because you guys know what your thyroid medication is? It is synthetic. Typically, Synthroid is synthetic T4. It's levothyroxine. So you're just putting more and more crude oil in, hoping that your liver is going to convert it. And if your liver is not converting it, you're not going to do any good for your thyroid, other than you'll actually cause it to down-regulate its production of T4. And so you'll just slowly put it out of commission, and then you'll be dependent on that Synthroid drug for the rest of your life. Do you think that's what the pharmaceutical companies are looking for? Yeah, they probably are, because it makes a lot more sense to get everybody on their medication, and you're on it for life. So anyone ever wonder what happened, like why my labs look fine but I just still don't feel normal? You go to the doctor, you just feel a little bit sick. Doctor comes in, he says, great news, everything looks normal. And you're like, well, shit, I still don't feel normal. And so you want to look at it on how your labs are optimally, because does anyone know how they calculate your lab ranges? So if you go into the lab, typically what happens, the way they develop these lab ranges, it's based on a bell curve. So they take everybody that has gone to that lab and they take the averages and they say, okay, these are within the normal ranges. Who typically gets their blood drawn or gets lab work done? Is it sick people or healthy people? Yeah, you're right. Typically it's sick people. Most of us don't get our lab work done unless we're not feeling right. Okay, so we just got our lab work done with a bunch of sick people, and they take the average of those sick people. So if you're within normal ranges, you're pretty much just as sick as the average sick person. So when you look at your labs, we want to look at, okay, what's the optimal functional range? Because if you look here, if you're within that green area, then yeah, your body, that system in your body is probably functioning pretty optimally. If you're out here, it's out of whack and you're not functioning properly. But in Western medicine, what are we looking for? We're looking for a disease diagnosis. We got to find that disease pattern. I can't diagnose you with a thyroid problem, or I can't diagnose you with a different disease if you're in this area. You have to be in this red area for me to be able to diagnose you as a doctor. I'm not saying I'm a doctor. I'm saying that's what your doctor is trained to do. And so what our goal is to avoid you getting into this area. Or if you are in this area, let's figure out how to get you back into this area without having to use a chemical. And in some cases, we may use some medications to help bridge that gap. But most of the time, we want to see where you're at here. What you'll typically hear from your doctor if you're here is, okay, well, let's see what happens. Let's wait and see. Come back in 3 months. Where do you think you're going to be in 3 months if your health continues to decline? Yeah, you're going to be in a disease pattern, and then that's when the prescriptions start coming. Let's avoid that. We want to test and not guess. So when you're looking at some of your testing, we want to actually get down to the middle of it. This is actually an example of a test result. This is Regans. He's signed a HIPAA release form, so don't worry. But you can see the yellow is a single gene mutation. So he's got 4 mutations on this. This is a methyl detox profile from Cell Science. He's got the COMT and also MTHFR, and so his body's ability to methylate B6, B12, some of those B vitamins is extremely diminished, and so having the right type of methylfolate and some of those supplements or nutrients is essential for his health. But the one thing you want to watch out for with these genetic folks, if you're working with someone with genetic mutations, is if you utilize if you get them over methylating, they'll get hyper anxious, and that's not a good thing either. So you want to make sure you kind of have to test it and work up to things, and then find that optimal way. If you suffer with headaches, so back to patients, that is a inflammation symptom. But if you maybe get a frontal headache, you wake up in the morning and the front of your head hurts, it's typically going to be blood sugar related. Really good solution for that. So tip number 2 is eat like a teaspoon or a tablespoon of coconut oil before you go to bed, or an avocado. Some really good, clean, healthy fats can help stabilize your blood sugar throughout the day. Also, if it could be thyroid related, if you wake up with just a general headache. Anxiety is tired and sluggish. These are all symptoms of inflammation. So let's talk a little bit about weight gain, and I'm going to give you guys a couple solutions here on how you can start balancing your body to lose weight. But notice how it's an inflammatory symptom, not a cause. In Western medicine, or in America today, how do we typically address weight gain? Yeah, we're cutting calories and exercising more. So eat less, move more. Everyone always says that's how you can lose weight. Will you lose weight long term? Well, let's say short term, possibly, probably. Long term, is it sustainable if you're excreting more energy than you're inputting? Not necessarily. That is a recipe to feel like garbage. You just won't feel good. And the whole point of life is to feel good and have good relationships. You can't be present when your stomach's constantly growling. You can't have a good, wholesome conversation with someone if you're starving. That's not a way to live. And that'll actually that'll cause more adrenal issues long term, anyways. So you're going to cause more harm. So let's talk about some solutions. So a lot of people, what I like to look at is the biggest things. There's 3 main hormone factors that go into weight gain or weight loss. Your cortisol levels, your insulin levels or blood sugar levels, and your estrogen dominance factors, so toxicity in the body. So the first step is you got to regulate your blood sugar. You don't want to have spikes. What's our typical diet as Americans in the morning? We might think it's healthy to eat a big bowl of oatmeal, some fruit, maybe a piece of toast or some eggs and bacon, and then we'll have maybe a glass of orange juice. Hopefully most of you have learned that orange juice is full of sugar, and that's not an ideal way to eat your fruit. But that will actually spike your blood sugar like crazy. So you think about what that does to your blood sugar, and then come 11 o'clock it crashes and you're hungry all over again, and you start this cycle and your blood sugar levels cannot stabilize. They're jumping up and down because you're running on sugar. So as soon as you run out of sugar, your body's like, oh man, I need more, I'm hungry. So I want to flip that, because your carbohydrates, that's going to be a sugar that it gets converted into. But what we want to flip to is getting your body running more on fat for a fuel source rather than sugar. So getting some good clean fats in the morning can be essential. I love to get some leafy greens, maybe some sauerkraut, get a good clean protein that's light. Like too much protein in the morning, that's going to cause more inflammation. But maybe an egg, if it's a farm-raised egg and you're not sensitive to eggs, you want to check that. That can be really effective. And then you want to look at getting some maybe olive oil, avocado fat. You could do fat from grass-fed cattle, or butter, grass-fed cow butter. Or something like that that's really going to help satiate your leptins or your hormones. So that way you're not triggering that I'm hungry, but also you're running on that fat fuel source, because a gram of fat will last you a lot longer than a gram of sugar. And so then you're effectively regulating your blood sugar. Along with that, you got to regulate your stress on the cortisol levels. So do some good breathing, really eat foods that are going to help with your adrenals. So good clean proteins, leafy greens, some of those, Himalayan pink sea salt can be good. Depends on where you're at on some things, but and then lastly, you want to look at your estrogen dominance factor. So I'll go through some of these body types here in a second that'll help explain how you could know this, but you really got to detox. Watch the foods that you're inputting. Get some things that stimulate. We use a lot of different herbs and supplements to stimulate liver cleanse, GI cleanse, or not necessarily GI cleanse. You don't want to just wipe out your whole GI tract, because then you got to rebuild all the bacteria in there. It's essential for health. And then from there, just really look at what you're eating and avoid and eliminate some of the toxins that are in your environment and that you're exposing yourself to. Those are some things that will really help reduce your weight, because you're balancing some of the hormones that can cause weight gain. Here's 4 different body types. I'm not going to go into these with you guys. You should be pretty well familiar. We'll go through, this is really the objective, to find success. You got to find the answers, and this is the action plan that you got to have. So right here, this is where I'll stop and ask the group. All right, so did you guys learn something tonight? Did I keep my promise? I've never had someone say no. Everyone's like, yes, that was great. All right, well, is it okay if I go through and explain to you guys what our program entails and what we do? Great. So here, this is our 5-pillared approach. So this is really what we do. Is we like to look at some comprehensive testing and go through what overall is happening with you, and then we take you through our five pillar program. So we want to look at how we can optimize your digestive health and detoxification systems. We want to optimize your nutrition, what foods are good for you, and what foods are causing inflammation. We want to look at balancing your hormones naturally, look at the right type of exercise based on your body type and your hormones, and then look at how we can optimize your brain health, get your brain back online, and reduce those inflammatory responses causing that brain fog or causing whatever's happening. We're going to do our 3 T's. So we want to get the right testing, the right treatments, and the right teaching, because we put together a curriculum and an educational program, not just we're going to run some tests and give you some treatments and you'll be better. A lot of it's going to be on your end to learn and to understand and to make some adjustments and put it together in a systematic step-by-step approach and really get to the underlying problem. So I want you guys to ask yourself, how would your life be if you're able to have more energy, get your brain back online, maybe lose some weight, and really just correct your health issues and achieve your health goals? How's your life been affected thus far? What I find is when I was in health crisis, or when we have people come in health crisis, it is so hard to be present. And if you're not able to be present, you're not able to work appropriately, you're not able to have an effective relationship. You may not even know it, but your health problems may be affecting your loved ones a lot more than maybe they're even affecting you. And so really, on a scale of 1 to 10, how motivated are you to take care of your problem? So why do you think I'd ask you this question? Yeah, you're right. It's because you can't just come into our office and say, hey, I'm sick, help me, or fix me. We want to help you, and we'll help put that plan together, but you got to be willing to do the homework as well. And so we always have this saying, we take A students, we take B students, we can't necessarily help the C students. So an example of an A student is someone that, you know, they're really motivated, they come in, they do their homework, they get the job done, they just go for it, and they get amazing results. B students, very similar motivation, they might fall off the wagon every once in a while. A lot of our patients are B students. I'm actually a B student, and we work great with those, and they get great results. But who we struggle with, and someone that we can't necessarily help, is the C student, someone that procrastinates. They procrastinate their health. You know, so if you're saying, oh well, you know, I'll call you back next week, or I got all these things coming up, I'll wait till I'm done in 2 or 3 or 10 weeks. Are you really going to make health your priority? And so that's what I'm challenging you guys to do tonight, is really make your health a priority. Do something about it. This is a Chinese proverb that we really like to live by at our clinic. Tell me and I may remember. Show me and I will remember. Involve me and I will understand. So we don't want to just show you or tell you about your health. We want to get you involved with your health so that you can actually understand what's going on, and so you can have your health independence for the rest of your life. So you guys got 2 choices tonight. You can keep doing the same exact thing that you've been doing with your health, and you know, maybe you expect something different, maybe not. We know what the definition of that is. Or you can choose to do something bold, do something different. Maybe take a chance at doing something different and new with your health that maybe you've not considered before. Maybe you've tried this and you've got a little bit of progress, but you're just not quite where you'd want to be. Give it a shot. This is something that could be life-changing for you. So is it okay if I kind of discuss our consultation fees and some of those things? And like I mentioned at the beginning, we do have a discount for you, but is it okay if I go through those? Is that all right with everyone? So notice I got everyone's permission to talk about how much it costs. Okay, and so this is actually, I'm going to do this in presentation mode just so you guys can see this a little bit better. All right, so what the first step to work with us is really come in for a complete wellness evaluation. What we're going to do is sit down with you. We actually block off an hour of our time. We'll sit down with you and really evaluate your health. Based on the questions that we're asking and everything, we'll be able to identify some different potential underlying problems. And then from there, we're going to come up with a plan of action. Once we discover what your goals are and if we can help you, that's when we'll come up with the plan of action and really construct what needs to happen going forward. So how much time do you typically get with your doctor when you come in for a visit with him? Yeah, maybe 10 minutes. Yeah, the average with Medicare right now is 7 minutes. So we're going to set aside a full hour of our time. And do you know how much your doctors typically charge for, let's say, an initial evaluation visit where they're spending maybe 15 minutes with you? It's between 250 to 300 typically. So what we valued our time at is 287. And so from there, if you feel like, hey, this is something that I really want to do and move forward with, we don't want finances to be a barrier. We actually dropped that by 87 or by $200, and so your initial investment's 87. Any family or spouse members only 47. We do want you to bring a spouse or support person to come with you, and so if they do join, that there's no cost to them, but if they're being evaluated, that's an additional discount that you can have. Some rules that we have, we're going to be giving you some paperwork. Please make sure that your paperwork is 100% filled out before you come in for your visit. That way it doesn't take time into that visit. And we'll be able to evaluate that paperwork before we sit down with you. That way we're not focused on your paperwork, we're focused on you as the individual. Second piece, please bring your spouse or support person, someone that can help with you as being an accountability partner, or just help you make a good decision about your health. And then lastly, if you have any labs that you've had ran in the last few months or last 6 months, bring those with you. Those can be helpful, and then we can better construct your program going forward. So, all right. So hopefully that gave you guys a really good idea, good gauge on how you can perform in an effective dinner lecture, dinner talk. Have a good close. Typically with that, we'll get at least a good percentage will sign up for that consultation, and from there most of them will convert into full patients. And so yeah, thank you guys for joining me today. Hopefully you learned something, and just keep those things I talked about at the beginning with our upcoming events. Get those marked off on the calendars. So we got June 23rd, 24th, get out here for the stem cell event. July 15th, 16th, October 14th, 15th, December 9th, and 10th. Love you guys. Have an amazing Tuesday, and we'll see you next time.